Hey there, welcome to another episode of Your Faith and Health Community. I'm your host, Pastor Jackie Jackson. And as always, on behalf of myself and our producer, Anita Alexander, we want to thank you very much for taking time out of your day to spend with us. Definitely, we'll give you some information that will improve your quality. So what I'm going to do that you may not be used to is jumping right into the show. We have from the Cincinnati Health Department 3 individuals here that are going to give you some information. You know, the Bible says, my people perish for lack of knowledge or lack of information. Today, as always, there will be no need for you to perish. So get a pen, get a piece of paper in case you need to write something down, in case you need it so that you don't forget it. All right, let's get started. I mentioned we have here with us 3 members or employees from the Cincinnati Department, City of Cincinnati Health Department. And we have with us first Dr. Camille Jones, who is the Assistant Health Commissioner. Yeah, we got some heavy hitters here today. We have the Assistant Health Commissioner, is also the Division Director of Community Health and Environmental Health Services. To my right, and I've worked with this young lady before back when I was with Enroll America, so it's awesome having her here. Yeah. Angela Robinson, who is the Outreach and Enrollment Manager. And over to the far left, we have Mr. John Sanders, who is and I'm going to try to get this right, the sanitarian supervisor. And shortly, he's going to explain to you what the sanitarian supervisor is, because when he told me, I thought he was like an extension of some bishops or something like that, you know, a hierarchy up in the church. But it's not that. You're going to get that information. So we're going to jump in here. A question that you may have or you may not, you may already know the answer to. I'm just going to be honest. I know of the health department. I've been to the health department. I've seen the health department. But in all actuality, I don't totally or maybe have a real good understanding of what exactly the health department does. And so I'm going to turn to Dr. Jones first to start this out. Why don't you explain to us, what is the health department?
The health department is an agency that's really dedicated to improving the health of the citizens of Cincinnati. We work mostly in the background. A lot of the activities that we have, people don't see because we're trying to prevent illness and improve health. But we are a basic public safety entity. We've been around for 192 years. We started in 1820, and we've been offering clinical services since the 1930s. Most times when people think of the health department, they think of the clinical services that we offer, but we as a health department are a gem because we have both the basic public health services and the clinical services that we're offering. And examples of basic public health services, things like environmental health, decreasing environmental hazards. Mr. Sanders, who's going to be talking soon, will be talking about food safety. We also do things for healthy homes to try to make sure that the hazards in the homes are abated. We look at things like swimming pools and when you have mosquitoes, we're doing testing for the mosquitoes to make sure there's not West Nile virus in the mosquitoes. And if we do detect it, then we're giving people information about how to decrease the risk of being bitten. So, and that's just talking about some of the things in my division. The health department has 400 employees. We have 7 major divisions, and we do a lot in the city to try to improve the health of the citizens.
Okay, so let's do this. Let's jump over, since you mentioned Mr. Sanders. I'm going to call you John. Is that okay?
That's fine.
John. Since you mentioned him, when I think of the health department, and probably a lot of people, the main function I always thought about was they go out and they check houses or they check apartments to be sure everything's okay, and then they go to the restaurant. And to be honest with you, for a long time, that's what I thought the whole function of the health department is. There's so much more, but that part of restaurant safety, we all at one point or another are eating out someplace. Right. And we were talking earlier, you know, about some of the questions or some of the issues that I've seen or what I assume are issues. So what exactly do you do, or the sanitarian, what exactly is that position?
Oh, okay. Well, what it is the sanitarian, which is also known as a health inspector. And we typically go out to restaurants or any type of facilities and do inspections. Now, I am the supervisor of the food safety program, which means we do all of the inspections for any type of restaurants, or any type of grocery stores.
Grocery stores.
As well, yes, exactly. So when we go through our sanitarians, we'll go through and do the inspection, check lists from items 1 through 66, a big long list that we check for, and they're in compliance or they're out of compliance. We check food temperatures, food safety, we watch for employee safety, which means they better be washing your hands, because the number one way to contract the foodborne illness now is through improper hand washing. So we make sure that all food employees are washing their hands and using like gloves and things like that, hair nets, hair restraints, and making sure the food is safe. And our main goal is to protect every man, woman, and child that eats in a restaurant in Cincinnati, Ohio.
And that's a good goal. Now, let me ask a question. Washing your hands. I've been in restaurants, and I won't say the name, although I want to. I've seen people go from the mop to the register. And there's been times where I've even had to say, you are going to wash your hands right. And then they turn around as if to go, oh, yeah, that's probably something I should do. And you said hair nets. I can't remember the last time I've been in a restaurant where there's a hair net. And then I got one last thing I want to add to that. In terms of grocery stores, and I guess it does make sense, but I have to be honest, from my standpoint, I never thought about the health department and the grocery store unless there's, like Kroger has the kitchen, they have a deli or something along those lines.
Right,
But do you have something to deal with other than in, say, the deli department or something like that? Are you coming out down the aisles as well?
Yeah.
Really?
By all means, the deli is only a small portion of our inspection when it comes to a big Kroger's or IGA or whatever. We look at all parts of the grocery store. First of all, we always go back in the back area where the food comes in to make sure it's being delivered properly and coming in safely. We do break down a grocery store into different areas. Like, let's say, for instance, we have the deli area, but you also have the frozen foods department. You also have seafood. You have all kind of different, you have bakery. So each one of our inspectors go through each and every department and score it and inspect it properly. We also go up and down the aisles when we do a grocery
Canned
store.
goods.
Yep, canned goods. And the most important thing we do is actually we look at baby formula, and we always pay close attention to the date, the expiration date, because that's very important. If you're selling expired baby formula and giving it to the public, you can make a baby sick. So those are some of the things we do. We look through a rotisserie area. If you have rotisserie chicken, we do it all. It takes us a while.
You said 67, is it 67, 61 checklist?
66 items
66.
on our checklist, and that's newly formulated from the state.
Okay.
Yep.
And can you talk about some of the instruments that you use?
Oh, I sure will. When one of our inspectors go into a restaurant or grocery store, the instruments we will have, obviously, we show our badge. We have a flashlight so we can see any behind equipment. We also have a thermometer. That's probably our most important item. A probe thermometer, probe in the food to make sure the food is at a proper temperature. As far as anything else we would need, that's about it. Flashlight, phone, thermometer, sometimes test strips to test sanitation level and clean and dirty water, and pH strips. And that is to test sushi, to make sure that, that's properly being handled.
See, I think the best way to test sushi is cook it. That's just my opinion. So this isn't a put on your Stacey Adams and job, right? Because you're saying you're going behind equipment. So it's really to make sure that every aspect of a grocery store is clean. Because I would assume if there's, I don't know, if bacteria is in the front, eventually it's going to make its way around. Would that be a safe thought?
Yeah, that's one thing we do look for. Mold is more visible than bacteria, obviously. But as far as the bacteria, we just look at the age of the food, how long it's been out. We ask those questions because food can only be held for up to 7 days in a refrigeration unit, and it has to be date labeled. So we check for things like that. If it's been there longer than 7 days, then bacteria can start to develop.
So then let me ask you, so let's say you're in a grocery store or you're in a restaurant and you see something that concerns you, right? You're looking at a process. Anybody can forget something once, right? But if you notice, if it's a place you frequent or you're in there and you notice that hands aren't being washed, you notice that, I don't know, gloves aren't being worn, or the person is going from the cash register back getting your chicken nuggets. What do you do? I mean, do you make a phone call? Do you tell the manager? What recourse, or what should the average Joe in the grocery store do?
That's a very good question, because a lot of times they're not going to do those things in front of us. They'll do it in front of the customer. So basically, all we ask is just contact the Cincinnati Health Department or whatever health department area you happen to be in where you see the violation going on. Just simply call us, let us know when it happened, what you saw, and then we'll go unannounced and do an inspection to see if we see those same activities going on.
Okay, so there you go. If you're in a restaurant, if you're at Kroger, he said IGA, you could tell he's over 20 because he said IGA.
I sure I am over 20.
But if you're at a grocery store, you're in a restaurant, and you're seeing something that's not making sense or you're concerned about, reach out to the health department. And Anita, our producer, she will have that information up on who you need to reach out to, probably John or whatever. But it's up to us to make sure that we're just as safe as it is the health department's job to make sure that we're safe. So if we're not paying attention and we're not looking, because like John said, they're not going to do it in front of them. And if they do, then you got to wonder not just about their health, but their mental health. So, so let's move on. But thank you very much, John. Dr. Jones, let me see. You are the director over the environmental.
It's the Community Health and Environmental Health Services Division.
So I think, tell us, let's talk, what is community health and what is the environmental health?
The community health part is our health promotions and worksite wellness, our epidemiology and evaluation. We have a vital records, we run the vital records office for the city, which includes not only registering births and deaths, but also providing statistics about births and deaths, to help with surveillance. So there's a lot that's going on. We have, in addition to the food safety, the healthy homes that I mentioned, solid waste in terms of monitoring landfills, looking at how tires are held to make sure that they don't pose a health hazard, and the health hazard would be collection of water and breeding of mosquitoes. Tattoo parlor licensing, household sewage inspections, rabies investigations, swimming pools. If people are going into the swimming pools in the summer, you have to make sure that the level of chlorine in the swimming pools is at a certain level so that you don't have the risk of transmitting disease from one child who gets in the water when they shouldn't have with diarrhea to other people. So that's just that part of it.
What do you have, a staff about 20,000?
We need more.
We need more.
We need more.
I mean, because you just ran down a whole list, and probably things, the most I think about tires are that $3 I have to pay to have my tires disposed of when I go get new tires.
Right.
I think that's the most, I never think about a tire as an environmental hazard.
Yes, it is.
So just along that line, are there some more things that maybe someone like me wouldn't even think as an issue? I know you just ran down a long list.
Yes. I didn't mention childhood lead poisoning. And that's a very very significant risk because
Still now.
Oh yes,
in
people
this
think
age.
it's over, but it's actually getting more and more. The level that's considered lead poisoning has been decreasing over time because people have found that kids still have problems, learning problems, behavior problems, and it's now said that there's no safe level of lead. But we have some neighborhoods where we have, up to 10% of the kids lead poisoned.
Wow.
Lead poisoned.
Lead poison. So let me ask you this then, because when I think back when I was younger, about 15 years ago when I was a kid, and I think back to that time, I always associated lead poisoning with kids eating chip paint. I have no idea, I'm sorry, I'll be honest, I don't know any other idea of how a child would get lead poisoning, because that's all I knew, it was eating
Right.
chips of paint.
Some of it is not even eating chips of paint. Sometimes the paint itself will turn into a dust, and the kids, especially young kids, between the ages of 1 to 2, they start crawling and put stuff in their mouth and all like that. But and so that's a major cause of lead poisoning. But kids can get it from different types of things like toys, especially some toys that are made overseas.
Pencils?
Well, yeah, if they're looking
Okay, I
the
was
lead on
just
the
wondering.
pencils, we have a major thing going on with the Greater Cincinnati Water Works, where they're trying to assist people in getting rid of lead service pipes. And so, there still are some households in the city that have pipes that are lined with lead going into their homes. And there's actually a program that the Greater Cincinnati Water Works, or GCWW, has to help. It's a loan program, but to help people if they're replacing the lines, the water main lines, to help the homeowner replace the lead service lines going into their home.
So so I'm assuming that means that getting the water coming through the tap and whatnot.
Water coming through the
So
tap.
if it's so hazardous, and I'm going to ask you a question that you're not going to be able to answer, I know, but why is it still allowed to be used?
Why is the water still allowed?
Well, not the water, but why
The
if
pipes.
the pipes are if the pipes are causing the contamination?
We're trying to get rid of, we're trying it's gonna be over a 15-year span, but the goal of that program is to get rid of all the lead service lines. That
So
are going to-
eventually it's not
Yes,
going to be.
that is
Just
the
real
goal.
quick, let me ask you, if you even have these statistics. Say 30 years ago,
Mm-hmm.
with children with lead poisoning versus now,
Mm-hmm.
has it been a major increase, would you say? Has it been a decrease, or it's floating
There-
around the same?
There's been a decrease in the number of children who have lead levels that are greater than 10. But now we know there's no safe level of lead. The level of concern that they have right now is 5 micrograms per deciliter. They're considering lowering it to 3, but really we don't want children to have lead in their blood. This is a recent thing that's happened over the last a couple hundred years. People don't normally have lead in their blood, and it's an environmental toxin. It's one of the most common causes, reversible causes of poisoning of reversible lifelong disability in kids is exposure to lead,
So-
and it's preventable.
So then what, God, I have like a million questions, and we're going to run out of time if I keep asking them, but what are the effects? I know if my child has the flu, I can see it. I can feel the temperature, the runny nose.
Mm-hmm.
If they broke their arm, it's looking funny. But if my child has these levels, well, any level
Mm-hmm.
is bad. But where it's actually affecting them, how do I know? How do I even know there's an
Check it.
issue?
You have to check it. And this is something that's really important also, is because we know that only about 35% of kids are getting checked for lead in the city. And Cincinnati is a city where most homes have leaded paint in it.
So there's a lot of lead.
There's a lot of lead, and also even when you demolish a home, when you do rehab for a home, you have to do it lead safe. But when you demolish a home, you just take the home down, and then you have sort of
All
dust
the
spreading.
stuff spreading around.
And so we know that there's a lot of lead in dust around the city. Most of the children who are lead poisoned are not going to be showing symptoms, but it's still affecting their neurologic
So there's no
development.
visual.
There's no visual for the levels of lead that we're talking about, but it still is going to affect them in the future.
And what all does it affect?
It affects their
Or-
neurologic development. It affects their impulsivity. Sometimes people who have had lead poisoning have symptoms like the ADHD, hyperactivity sort of symptoms. In terms of learning, in terms of just developmental, they have some developmental delays, and it's preventable.
So there are some things there are some signs, they're just not signs that we're going to see right away. So over a period of time, and then that
But
seems
what
like
you want to
it's
do, you
gone.
want to catch it. You want to catch it because even if the damage is irreversible, the damage is also cumulative. And so if you catch it early,
Is there a lead home testing kit?
No, you have to, you can, but any parent, and this is very important, any parent can bring a child to one of the Cincinnati Health Department health centers and request a lead test. And we have a sliding scale system for payment, and so, income it should not be a barrier to requesting this lead test. Only 35% of kids are being tested. And then we know in some neighborhoods, 10% of the kids who are tested are lead poisoned. But for the 65% of kids who aren't tested, there's a lot of them who are lead poisoned too.
Right. So you only have a 10% based on who's coming in.
Who's coming in.
Which means that, like you said, we have a lot of
work to
children who may be getting, maybe I'm taking this too far, but getting bad grades.
Yes.
And it's not that they're not trying.
Right. They
It's
have
that
lead
there's
poison and
there's
don't
something
even
going
realize
on.
it.
Right.
Mhm.
Wow.
Right. And it's sort of sapping the strength of the kids of our city.
Wow.
Because we've got brilliant kids, but if you give those the neurologic insults, then you may be smart, but you're not as smart as you would have been.
So again, like I said, I hope you're getting something out of this. I'm getting educated right now, and that's a good thing. I hope you're getting educated, and some of the symptoms, some of the things that Dr. Jones has mentioned, even if you're seeing something like that or you're concerned, get to a health center, get your child checked. Maybe check yourself too.
And check that child age 1 and age 2. But if the child's older than age 2, if they've never been checked, get them checked whatever age.
Even my age, 21.
Yes.
I should get checked too.
Well, the other thing is that a lot of times people are doing rehab. And many people don't know that there's a safe way to do rehab in your house. So people are scraping that lead paint, and they're not doing it in a lead safe way, and they themselves could get lead poisoning.
I've done that before.
Yeah.
All right, I want to move. Were you getting ready to say something?
No.
I'm sorry. I want to move over because I want to make sure we don't run out of time, and this is also equally important. Open enrollment has started. It started November 1st. So all of the life-changing, you don't even have to worry about that now. If your compliance is at 2 months over. And Angela Robinson is an enrollment specialist. She knows the whole thing. That's why she manages everybody. and she's very good at what she does. So why don't you talk about open enrollment? It's here.
Yes, finally,
survived.
we survived. So we are now into open enrollment 6, if you
6.
can believe it. We started this in October 1st of 2013 was the first year, and we are now at the 6th open enrollment. Unfortunately, though, however, there are only 45 total days for people to enroll. It started November the 1st. It ends on December the 15th. And that time includes weekends. So people have a shorter period of time to enroll. The advertisement is not there, so people don't really realize that it's open enrollment. So it's really great that you have this opportunity for the listeners to know now is the time to call, to get some assistance, to get that health care that you've been without for the last year or 6 months.
Or longer.
Or even longer. It's never too late to get health care. And so it's really great. We have local people here that can help you. And that's what, Pastor Jackson, as you know, I've always been passionate, just like you have been, about having that local connection, of having somebody to talk to, to sit down with, that can help you navigate that whole process. It's great to have the healthcare.gov. It's wonderful. But the people that we assist, and we have some of the toughest clients that come back year after year after year. And that's great. We're there to help them. But now is the time to do that. I think December the 15th is on a Friday, so the time is just ticking by, and we've been really busy with people calling, but now is the time.
Places, right? 'Cause
And there are
when we
less.
started, you could get enrolled at the bus stop eating a sandwich.
Exactly.
And
You could go anywhere to get to get help with your enrollment, but now it's pretty limited. The funds that the federal government now makes available is limited really to mainly the health centers, and there are a few navigators that are out there. We still have a navigator that's in the Dayton area.
Oh, really? Oh, okay.
But
what are they called? That's
I can't remember.
Because Marjorie worked
Right,
there, and
absolutely.
I don't remember.
Absolutely. But all of the local health centers still have certified application counselors that are available to assist people with open enrollment.
So is that, so literally each health center?
So each federally qualified health center should have at least one person that should be available to help them. And even if you don't live in the city of Cincinnati and you need help, you can call, and I know Anita will have our number, and I'd be willing to help get you to a place that's closer to you.
Even from Kentucky?
For assistance. Kentucky, I have a connection in Kentucky also that I've been working with for the last 6 years, that she refers people to me, I refer people to her, because we just want to get people connected. We don't want any barriers in the way of people not knowing where to go. I don't typically give you the answer, I don't know. I may say I don't know now, but let me call you back and I can give you an answer. So yeah, it's really important, I think, that people know open enrollment is now and it ends on December the 15th. So please call.
So it's not even
call.
45 days. What is the
It's
day?
a total
The
of
8th?
it ends on the 15th. It started November the 1st and it ends on December the 15th. And so it's a total of 45 days, but we're down to, around 30 at this point and even fewer. So we want to make sure that people know that now is the time to call in order to get help.
And listen, don't wait.
Yeah,
I
so
remember the days.
During the time when we first started, you could wait,
Yeah, 'cause it
or
was
people
like
did
forever,
wait.
yeah.
We had people who were in line, and in line meant you had made a contact to one of us, or you called healthcare.gov and asked for assistance. Now, if you do not enroll by midnight, I say actually it's 11:59 on December the 15th, you have to wait an entire year unless you have a special enrollment period.
Without insurance.
Without insurance. And you do not want to be without insurance for a whole year. Anything can happen.
Anything.
And we've seen cases throughout the last 5 years of people who begrudgingly enrolled into health care only to call us 3 months later to say, I'm so glad that you helped me navigate that. I had a major catastrophe happen and I needed that health care. And we just, we not only help people enroll into coverage, we assist people in understanding the language and how to navigate the healthcare system in order to use the coverage that they have.
Well, let me ask you, what about, and I know when I was enrolled, we had started education, right?
Mm-hmm.
Because a lot of people did not know how to use.
Correct.
You obtained the health care.
Right.
Then you weren't sure how to use the health care.
Right.
So is there still assistance to help people understand?
Yes. We still do, and all of the health centers still help people understand, well, how do I use this new health care? What's a copay? What's co-insurance? What's a deductible? Those are common terms that even sometimes, general lay people, we just don't understand those terms, but we help people understand that. And we help them with the marketplace. It's really important because a lot of times people are just looking at that premium. They're looking at that premium and that's all they're looking at. They don't realize that you may pay a slightly higher premium, but you may have a lower copay, you may have a lower deductible, lower co-insurance, so we help them
and the deductible,
navigate.
Really, a lot of times it's the deductible that's going to really
Correct.
hit you
Right.
the hardest.
It is. It is.
That becomes important, and I see Anita giving me the signal.
Yes.
On what is the guideline? I've been doing it up until open enrollment, but
Mm-hmm.
what is the actual guideline? Let's say I'm single and I make $16,228. Am I good? Am I still Medicaid? Am I Marketplace?
If you are between the ages of 19 and 64 and you make the amount of money that you just said, you're still eligible for Medicaid.
I was right.
Be
sure I was getting the right information.
Yes. So you can actually enroll into Medicaid throughout the whole year.
Right.
But what we don't want people to do is to wait until after open enrollment is over to go and apply because you may be over income. And if
Right.
you're over income for Medicaid, again, you have to wait until the year is over until the next open enrollment in 2019. So we always encourage people to come in if you don't have health care. Bring in your information so we can help see if you're eligible, not just for Medicaid, but how to help get you into the marketplace.
Best.
And we help people throughout the year who come in June and have never had health care, but they're over income for Medicaid. And so now's the time of the year that we are encouraging people to come back.
And I want to thank you all for coming out. But listen, I want to thank you very much again for taking time out on behalf of myself and our producer, Anita Alexander. We really thank you for your time. And